It is a Working Woman Wednesday, and from time to time we slide some working women in the building. And this morning we slide this working woman in the building, live from Atrium Health Project Boost. Y'all say what's up to Miss Britney Brown.
Hi, Britney.
Good morning.
What's up?
Now, June is Violence Prevention Month and Gun Awareness Month. And you work on the front lines when it comes to violence in the city of Charlotte. Like, in your position, what are some of the things you're seeing right now going on in Charlotte?
Yeah, we are seeing definitely an influx in community violence with our young folks, particularly. We have a lot of teenagers. I'm talking 13 to 18 coming in with shootings at parties, out for the weekends, these drag racing with these cars. So a lot of heavy youth violence that we're seeing around the city.
What are some of the success stories that you're seeing, and how are we getting to those successes?
Yeah, I think the great part about what we do is we catch them at a really vulnerable moment. So not only are they experiencing something that they usually have not experienced before, this is the first time they've been injured like this, but they're also stuck in these hospital beds. They're confused about, what life means after this violence. So they really are looking to turn around things. So a lot of our folks are wanting connections with mentorship and employment services specifically. So we've developed a lot of community relationships to get them job ready, because a lot of our young men and women are like, I just want to make money. I just want to make money, but they don't have, direct plans. Mm-hmm. So we've been able to work with countless young folks and get them either in GED programs, back on track with school, and also set up to do their resumes, learn how to tie ties, the proper attire to wear for interviews. And so we have over 20 folks that we've worked with that are now employed and have resumes and are looking to go into college or trades once they finish school.
Now, with the program that you work, I know you see a lot of people where something has already happened to them. Do you get people come into the program that they're trying to prevent something happening in the future? They come to you like, hey, I feel like I'm about to get in trouble, or I'm headed down the wrong path. Can you help me?
Yeah, so one of our criteria is that they have to be admitted to the hospital for an injury, excuse me, but we work with families, friends, so we've been able to intervene with younger siblings or even older siblings that are involved with patients, and we also have other trauma programs in the hospital, and they refer us patients. Currently, we have a young man on our caseload who got into a car accident. He was joyriding, he stole a car, got in an accident, and he was referred to us as someone that's high risk for potential violence that he might experience or, potentially be a perpetrator. And he's been working really well with us, been really vulnerable. So there are times like that, and we're thankful for Atrium being really communicative with us and letting us know this person might need some support. So we're always open in that way in the hospital.
Brendan, let's back up because we dove right in. So let's talk about what is your position and exactly what do you do in Project Boost?
Yeah, so I'm the manager for Project Boost, Boost standing for Building Optimal Outcomes for Survivors of Trauma. So we see all participants that are admitted into our level 1 trauma center. So level 1 meaning we see the severest injured patients within the city, and we sit with them bedside after their injury has occurred. It's primarily our gunshot victims, but it can be an array of things. So if there's a stabbing, if there's a fight, anything serious enough to get them admitted, we'll meet with them bedside. We do an interview with them, very informal, so just trying to get to know them, figure out if there are any gaps within their life, within their communities, their families, and we connect them with those community organizations that can fulfill those specific needs.
2 questions for you. One, are your patients only youth, or are you dealing with people of all ages? And then my second question is, can you talk to us about some numbers? Give us some stats about what's going on in our community right now, like the latest numbers that you have.
Yep. So great question about the age range. So we've actually just expanded. So currently we're seeing anyone between the ages of 12 to 35. Mm-hmm. So we do see adults as well that come into the hospital. The goal is to see anyone that comes in, but we're a small staff right now. There's 2 intervention specialists right now. So we fight the good fight. We're trying to figure it all out.
Fight the good fight.
Yes. And the second part, sorry, what was
the
it?
stats, what's going on, or what you're seeing as far as violence in our community?
For the year so far, so for 2025, we've seen about 70 patients overall. Since we originally just had 12 to 24, we saw about 400 patients over a 2-year time span. So of that, we've been able to enroll about half, so see about 260-ish that we've been able to support with community organizations. As it's getting warmer, I'm seeing things increase quite a bit. On average, we'll see maybe 3 patients a week come in. This last week, we've had already 10 that have been admitted into the hospital just for the week. So,
And what types of violence? All right,
gunshots?
gunshot.
For sure.
This is all. But not all.
Not all. Yeah,
Okay.
I would say out of the 10, 8 of them were gunshot victims. The other 2 would have been stabbings.
And
So you said earlier that your small staff. How does one even get into a position like yours? Like, how did you even get started to do what you're doing?
Yeah, I mean, it just kind of happened. I was living in Chicago, doing similar work in the city of Chicago. So I was working primarily with women that were experiencing violence and co-occurring drug addictions and mental health concerns. And Charlotte was talking about starting a violence intervention program. So the programs like this exist all around the country. There are hundreds of them. Charlotte did not have a program until 3 years ago when this started at Charlotte's Atrium campus. So I heard about it. I kind of knew some folks here. So I kind of chit-chatted with them. And before I knew it, they were asking me to move to Charlotte to help get the program off the ground. So now I'm trying to base myself in our communities a little bit more because we're looking to expand as much as we can. We are grant funded, so we're looking to get more funding so we can get more employees. So that's a big feat for all of this. But it really just kind of happened. I didn't expect it.
we had an opportunity to go to Chicago one time. Beautiful city. We enjoyed our time there. But in the same account, we do know that Chicago does have a reputation for violence. With you working in Chicago, what similarities do you see from Chicago and the Carolinas?
The hugest similarity would be lack of resources, trying to pull together funds. There are specific needs in specific areas in every city. So it might not be, the same. So just as you kind of know, the south side of Chicago is the most needed area. For Charlotte, I'm seeing that there are specific pinpoint areas that need more resources. And so I don't think that things are evenly distributed across cities. So I see that huge similarity in Chicago and Charlotte. So trying to fill in that gap by expressing it to city counterparts and people that can hopefully be change makers. But that is for sure a huge thing, is how do we support them financially?
Britney Brown, Project Boost is live on Working Woman Wednesday. We'll be back with Britney. It's a Working Woman Wednesday. No Limit Larry, the Morning Madhouse. Charlotte's plug for new hip-hop and R&B. Live inside the Madhouse on this Working Woman Wednesday. Miss Britney Brown from Atrium Project Boost. Hanging out with Britney this morning. We're talking about, what type of services do y'all offer in the hospital, at Atrium for gunshot victims? Like, what type of services do y'all offer exactly?
Yep. So we start with mental health supports. So we know PTSD might be a huge concern. So we do PTSD screenings with anyone that comes in. We also know that PTSD is long-standing, so it might take some time. So we do an interview with them for PTSD about 3 months after they have had their injury. We offer mental supports in the sense of mentorship. So we try and connect them with a peer, someone around their age and demographic group that can understand them in ways we might not be able to understand them. Our employment services are a must as well. And then any sort of utility services. So if they need help with gas, electric, whether it be a parent or the person that's been injured, those are the major ones. But any need they identify, we try and connect them with
resources. That's dope.
Question. So what if there's someone who comes to your program and they might not necessarily have like a gunshot wound or some type of injury from a car crash like you were speaking about earlier, do you direct them to, but they might be looking for help in a way. Do you direct them to other programs outside of what you do? Explain that a little bit.
Absolutely, yes. If they are either referred to us in the hospital or if we read their case and see that they may need some sort of supports, we'll go and see them for sure. We're connected with a lot of hospital organizations as well as outside. So we have what's called the Community Resource Hub that we use through Atrium. So it's this huge network online where we can put in their zip code and any need they have. And hundreds of nonprofit organizations will pop up and we'll connect them directly through a referral system that way. And we can also follow them on their journey. So what I didn't mention is we kind of keep them on what we call a caseload. So we keep in touch with them. We keep their information. We'll see them outside of the hospital, stay in touch with them via phone, text message, email, just to make sure that they're still good.
And earlier you said y'all was short-staffed, so you think y'all be hiring anytime soon? And what type of people qualify for this type of work?
Yep. So we are hoping to hire one other intervention specialist. Right now, we don't have any emergency department supports, and we know so many folks, especially on the weekends, are coming in for injuries. They're getting patched up and leaving pretty quickly, and we're missing that patient population. So we want someone hired by the end of the year for that position for sure. There's no specific criteria.
Okay.
Education doesn't matter, background doesn't matter. We know that this type of work is people work. So we want you to have experience with this type of population. We want you comfortable in these rooms with parents, family members. We know this is high emotion areas. So as long as you are level-headed, you understand that these folks have not only this injury they're going through, but when they go home and they go back to these communities, it's serious. Then you're a good candidate.
I'm sending a text right now.
Come on. Come on over.
Bourbon, I don't think you built for this.
Man, text. Oh, no, it ain't for me. I'm sending a text to somebody who need it.
Hopefully they ain't in their soft girl era when they don't want to work.
Well, listen. Yeah. No soft girls allowed, okay? This is the real work.
This is the real work, right? You gotta come in.
Yeah, working.
Working.
So let me ask you this, because, here in the city of Charlotte, we see, violence on this side, violence on that side. Like, you're working on the front lines at Atrium. You see the patients as they're coming in with these gunshot wounds, these stabbing wounds. Like, what side of the city is most of these victims coming from?
Right now, we're seeing a lot of activity in our kind of northeast area. So a lot of university area. We're seeing a lot of gunshots specifically. Sugar Creek area, we're seeing a lot of injuries. So that northeast area is really hot right now. We don't know why, and we don't share that information with everyone. I'll share it with y'all because we family now, because we don't want any areas to specifically be targeted by people that they shouldn't be targeted by.
Right.
But for the sake of what we're doing, we are noticing that, and we're hoping to even expand into the university hospital, because there's a lot of folks that are getting injured and going to the university hospital that we don't even get to see.
So y'all missed that, like, because they don't have that over there at the university hospital?
They currently do not have anyone over at university to do that. So.
All right.
So where do people go if they are? What happens?
If they're injured and they are admitted to university, there's no one on site to give them any social supports like we do.
Wow.
So
they got to come to Maine to get the social support.
They currently have to be at Maine, which is
But I would
tough
imagine
for us.
that's difficult for them to do if they're going.
Yeah.
Wow.
Very, very difficult. So I've been in touch with university's ED, and so they give me supports. And so, again, the way we're structured, they have to be in Maine, but we can still offer supports. We can still tell them, I know about this organization. I know about this support. Let me send it your way.
Where does funding for this program come from?
Currently through the city of Charlotte. They funded us, and we're hoping to expand our funding further. We also got some federal funding through Alma Adams, if you all are familiar.
Oh, yeah, for sure.
We've had her here before.
Yeah, for sure.
Yes, shout out to Alma. She got us some funding to expand, so that's how we ended up hiring our new intervention specialist. And through the funding she gave us, we'll hire one more this year.
That's what's up.
I asked the question because I know that, city council is going through they're making some decisions, budgeting decisions right now. Currently, they're having these meetings. And I think that is important, especially in the climate in the world, that people understand that we are a part of that process when
Yes.
it comes to where funding goes. And when you say that we're only offered in one area and we see an influx in another area and they are not offering those services in the area where there is an influx, we as the people, we have to sort of come in and we have to make our voices heard about this funding if it is coming from the city.
Yes.
Yeah.
That's a good reason I can be here too. So thank you all for having me. And shout out to the city of Charlotte. They allowed us to come in and do a presentation for all of City Council, and they were very intrigued. And so as they're doing budgeting, we are hoping and praying they put a little, little coin for us too. So we're
coin in there?
just a little coin for us,
Yeah.
just a little dime.
Yeah.
So we're hoping.
It always comes back down to that word we say a lot that people don't want to talk about and don't want to hear: voting. It all comes back down to voting and who you vote for. Like you said, Alma Adams, who's been in her seat for a long time, funding came for her because that she's been voted in by the people. So that's a direct instance of you see somebody you voted in making a difference. So there you go. But Britney Brown, thank you for being here this morning. Do you have any contact information, email, phone number that if people want to reach out to you, they can reach out to you?
Yeah, you can always email me. My email is brittany.brown@advocatehealth.org. Britney is BRITNEY.
And do y'all also accept private funding? Because there's a lot of private funded programs out here. So if anybody in that private sector wanted to fund this program, they could.
Absolutely. And if there are any organizations, any privately funded organizations having events and y'all want me to come and talk about what we do, please reach out to me.